Hey everyone, happy holidays. It's Dr. Rick, founder of Herbal 411, and I have to do a video on my antibiotic protocol of choice because in the last, say, 3 months, I've had a lot of folks blossoming with stuffy nose, sore throat, postnasal drip, and then some of that fraction have been turned on as far as their asthma triggers. I don't know what is causing the trigger. It's possibly from the fires of Canada, the fact that everybody has been masking for the last 2 years or so, and maybe now that we've unmasked, there's a sudden overwhelming amount of allergens in the environment that are triggering things. But regardless, and it could be also COVID. I don't know about the influenza and RSV thing, but there's certainly a lot of vaccines being pushed. But this is my go-to, and I haven't taken an antibiotic in I don't know how long. In fact, the last time I remember an antibiotic personally was when I used to work with Central DuPage Hospital. That was back in the 1995 to 2005 era. And the first dose gave me Clostridium. So the idea is to try to get as healthy as you can before the season, but in case you do have the symptoms of sore throat, postnasal drip, nasal or sinus pressure, and or a productive cough, I would get on top of this. So this is my protocol. I will be doing an informational podcast or video on why I don't like Amazon. Please consider shopping at your local brick and mortar. Vitamin Shop is fair. Fruitful Yield is my favorite if you're going to go shopping somewhere, or the associated websites for these places. Going on Amazon, again, I've had some problems, and you'll see my video coming up, and consider subscribing if you want to learn more. But my 3 tops, if you do have the beginning of infection, meaning symptoms, or if you were recently exposed and somebody in the household or at work is also with COVID or sinus infection or pneumonia, bronchitis, my top 3. These are all, I don't have anything to do with Now Foods, but these are all Now Foods. This one I can get at Now Foods, but I have such a bank of this stuff in my supplies that I wanted to use this instead of so this is Butterbur. I should say that this is what it looks like from behind, and the ingredients, you probably can't read that, but the reason I use it is because it's Butterbur. I typically will either use that or suggest to my patients, just go to Fruitful Yield and buy Butterbur, PA-free, 75 milligrams twice a day. And that's what's going to happen with all these things I'm going to talk about. The idea with these 3 are that astragalus has always been my favorites back since the 90s. Astragalus is a root. It has this calming effect to the gut and or boosting effect to the microbiome that helps with turning on or focusing the immune system to start attacking unwanted DNA, which is bacteria and or viruses. But I love astragalus. I would do 2 capsules 3 times a day to keep yourself busy. And during the time that you're sick, you can probably get rid of the other supplements that you're taking, depending on your supplements. And please, if you're not a patient of mine, consider joining my practice. But if you are a patient and you're not sure which to start, which to stop, message me on Get Healthy. So astragalus, 2 capsules, breakfast, lunch, and dinner, 5-day to 7-day duration of fighting an infection and boosting your immune system. Number 2, reishi mushroom. Reishi mushroom, again, another product by Now Foods. So mushrooms have been studied in China, in Asia, profusely, and they're starting to come over to the US as far as lion's mane, cordyceps. But I do 2 capsules 3 times a day, breakfast, lunch, and dinner, as well as the astragalus, and you can take them both together. And then finally, the Butterbur. Now, this is Garden of Life, which I love. I use this specifically for the Butterbur extract that they use. And also, this has Saccharomyces and a couple of other things that assist in the fight. So usually your immune system should be strong enough to mount a response in case there's an invading organism, whether it's the sinuses, the ears, the throat, or the chest. Sometimes even I've used this combination for infections of skin too. And again, in the last 30 years, I usually just use these things. I take them for about 5 days and then I put them back in. There are some patients who use this triplet of cocktail and then they say, I can't take it anymore, I need a little help, and then I'll give them an antibiotic. But then you don't have to stop this to take the antibiotic. I would use the antibiotic as a supplement to these guys. So this is my army. In case you have a lot of postnasal drip, I would get nasal crom Nasal Crom is a mast cell stabilizer, so in case there's an allergic component, it will help with the swelling. If there's no allergic component, then you don't need this. You probably should get a prescription for ipratropium bromide. I think that works better than Flonase or Astelin to decrease the swelling so that the bacteria you're killing off in there in the mucus can get out of you. Also to depressurize the sinuses in case it's a sinus infection. Those of you who you blow your nose and there's a popping sensation, that's eustachian tube dysfunction, that doesn't help when you're infected. So you might want to get the nasal sprays or just neti pot 3 times a day in addition to these things. If you have sore throat, this is fantastic. I love this is essentially going to be mushrooms and a tiny bit of peppermint or alcohol that's you spray into the throat for decreased pain. And that will get you at least the pain decrease with sore throat, post-nasal drip, or just that post-viral syndrome of achiness in the throat or nose. This will get you some alleviation. You can also take Tylenol. I wouldn't do Advil, but I would do this. I would rely on this and carry it with me in my pocket. The only problem is sometimes the spray gets a little bit clogged up. So let's go ahead. I like the peppermint version of this, but the theory is that you'd be spraying mushroom extract into the area that's in pain or the area that's being fought. Even if it's post-nasal drip that's causing the sore throat and you spray with this, the alcohol does give a little bit of desensitization versus pain relief. And when you're sick, you want everything that you want to get in you naturally for pain relief, because myalgias, body aches, and or sore throat and or headache, that can decrease your drive, decrease your concentration, and you're going to want to stay in bed all day. But that can also be detrimental. It increases the chances of eating more crap and or staying dehydrated and or just having muscle mass loss or weakness. When you're active, at least the psychological effect of being active and say drinking water without pain or not having to go like you're swallowing razor blades, I think that's very helpful in addition to what I just mentioned. So I have to do honorable mentions. That's my protocol. I have to do honorable mentions on quercetin. Quercetin and zinc were really great during COVID. Quercetin needs the zinc quercetin and zinc go together. They're symbiotic, but the quercetin is a natural antibiotic. It comes from plants as well, but the data on at least COVID from 2003 showed that when you use quercetin and zinc together, there was a decrease in the production of viral particles from the hijacked cells. The only problem is you need both of them to get into the cell, so it's important to use both of these. Sometimes causes upset stomach, by the way, so if you're going to use this in addition as your natural antibiotic, you got to take it with all this other stuff. And then finally, if you have symptoms of cough that aren't getting any better, NAC. Again, these guys have been popularized with COVID. NAC is great. If you're a diabetic, it does help lower glucose intolerance, I should say, in addition to decreasing appetite. But NAC also loosens mucus, has an effect to make it easier for you to cough up things. So hopefully this gives you a couple of ideas as far as my antibiotic protocol. For those of you who are my patients, please consider messaging me to let me know what's going on with you. You should always get tested for influenza and COVID. If you have somebody that's positive for RSV, again, there seems to be a spike in RSV, but I don't know if I would. Well, I'm going to leave the vaccine question out of this, but just message me. If you're not my patient, you can ask your doctor about if this stuff would be helpful for your protocol. And don't forget to subscribe, give a thumbs up, and share this with other people who are sick and coughing on you. I'll see you at the next video.